let's move to how we help consumers really manage, their expenses. And joining us on the program is really a friend of the Institute and a leader that's been in this marketplace for quite some time and is now taking over a leadership role with Copatient. It's Tom Torre, CEO at Copatient. Tom, good morning.
Good morning. How are you?
I'm great. Good to have you on the program. How about yourself?
I'm doing great. I'm excited to be here. I do wish I was with Ron in Florida, though, because it's snowing quite hard here in the Northeast. Come on down.
Yeah, I know. I told him to be easy with that, Tom, since you're sitting up north.
Yeah.
Hey, Tom. Listen, we look forward to seeing you in a couple of weeks at our Private Exchange Forum in Dallas. But give our audience a little background around Copatient and what you guys are doing up there.
Sure. I think I'll start by talking a little bit about the roots and the founding of Copatient and give a little bit of background on the organization. Copatient was founded in 2012 by a couple of folks who were working at Athena Health at the time, and they were working on an initiative to understand the issues associated with consumer payments to providers. And for those of us who have been in the consumer side of the industry for a long time, understand the challenges associated with consumer payments and the shift that's going on to individuals and the burden they're facing. And as part of that initiative, these two folks learned a couple of things. The first is that, in general, consumer payments to providers are broken. Again, no surprise there. Second, that providers typically collected something in the neighborhood of 20 cents on the dollar owed to them by consumers, which that number just still to this day amazes me that's such a low percentage. And the other thing they learned was that consumers don't pay providers for many reasons. Sometimes it's because it's a large bill and they're unable to pay, but more often it's a challenge understanding what they're being billed for and whether what they're being billed for is appropriate and is fair and reasonable. These learnings and some other research led to the idea of creating a company that would reduce the friction in consumer to provider payments, and so Copatient was born. Mm-hmm. So that's a little bit of background on the history of the organization. Now, I'm sorry, get back.
No, go ahead, Tom. Go ahead.
And then I was going to kind of go on to talk a little bit about what we do and how it works, or did you have a question?
No, that's perfect. That's what I wanted to ask you. So you're reading my mind, Tom.
Let me jump in with a question there. I think
sure.
I think this is really helpful and important what Tom's going through, because I don't think patients really understand the bills. I always say that the document that they send you called an explanation of benefits is the first thing you get in the mail that you ignore because you don't know what your final costs are.
This is not a bill.
Right. This is not a bill. One of the other things that maybe you can explain, Tom, to the listeners out there is, and it's sort of insider language, but it's something that affects them, I think, in the area that your company is focusing on. It's something that is usually referred to as balance billing. So when you get a payment from the insurance company, covers part of your cost, and you got a co-payment. But if you are not a network provider that is limited on charging something else, there's a balance billing that you may get to surprise bill. Why don't you explain to our audience what that's all about?
Sure. And, Ron, it's a great topic because it's a big part of what our business is focused on is balance billing. So, when you look at out-of-network transactions, when you go to a provider that's not in your network, which is increasing in frequency as the world has changed and there are narrowing networks as a result of trying to control costs. And in addition, some providers are just opting out of networks. One of the examples that are used quite often is anesthesiologists are typically out of network as a way to try to maximize their payments. So you end up with a lot more out-of-network transactions, and what frequently happens with an out-of-network transaction is some sort of customary and reasonable payment is made to the provider, but the individual is then balance billed for the remaining amount. And that customary and reasonable payment can be very, very small, and you might have a $10,000 out-of-network transaction or a claim, and you end up getting paid $500 by your plan, your health plan, because it's an out-of-network transaction. So now you're balance billed for that remaining $9,500. That is an increasing challenge in the marketplace, and it is an area that we're focused on is helping consumers manage and reduce those balance billing situations. Frequently what happens is that folks are billed at some crazy multiple of Medicare. They might be billed 250, 300% of Medicare rates because it hasn't been adjusted by the health plan, and then the individual ends up paying a large amount. So that is a big challenge in the industry, and that's one of the things that we're focused on.
Hey, Tom.
Yeah.
Tom, this is Doug. How do you differ from the many health advocacy firms out there, or
So what I'd like to do is, maybe to answer your question, Doug, is just give a quick overview of how our process works, and then talk to how we're differentiated, if that's okay.
Please.
Sure.
Yeah.
So, in summary, we work with consumers to help them with their out-of-pocket expenses, and a big part of that is helping them understand complex medical bills. When you go to the provider, your primary care provider, and you go for your annual visit, usually not too complicated, but let's say you have an illness or a disease that you're managing, or maybe you get hurt, you might receive an extremely complicated bill with multiple providers, multiple claims associated with it. And in some cases, in my case, and I've been in the industry for a long time, you never quite understand what you're getting billed for or what's on that, whether the billing is fair and accurate and reasonable. And, we work with consumers to help them understand that. And when it's not fair and reasonable, we work to reduce the amount that's owed. We do this today in two ways. One is we go direct to consumers, and then we also go through the employer, benefit administrator, and health plan channel. When we do it direct to consumer, we offer them very much a straight negotiation process. When we do it through the employer channel, we wrap around a whole bunch of other services, which I'll talk about in a little bit as we go through our discussion. But now to answer your question, Doug, and how we differentiate ourselves, the most common organization that we're compared to is Health Advocate, and so I think that would be a great way to illustrate how we might be different.
Yep.
Health Advocate, a good organization, provides a broad range of consumer advocacy services that helps consumers manage through the healthcare experience. We are specifically focused on managing provider expense and helping folks reduce their out-of-network and other expenses they have associated with providers. We're sort of an inch wide and a mile deep on that topic. We have a broad set of expertise, and that's how we differentiate ourselves.
Tom, could you? I could see you even partnering with them. Is that part of your potential opportunities to partner with some of these advocacy firms because you're vertically deep in your core competency?
Absolutely, Doug. We haven't to this date gone down that path, but that is definitely something that we could do, and we are exploring lots of different partnerships, and that would definitely be among things we would look at.
So Tom, we have employers listening. So if I'm an employer, what are your services for me? And I think you outlined what the services are for my employees, just to use me as an example as employer. So what's your services to me, and what's the business model between an employer and yourself?
Sure. So when we sell through to employers, our positioning is the following. The first is that we come in, and typically, self-funded employers probably more our sweet spot than perhaps a fully funded employer. But so let's focus on that for a minute. So we go to a self-funded employer. The first thing that we would do is use our tools to analyze their claims and identify opportunities in their claims patterns. Do they have a lot of out-of-network transactions? Do they have a high concentration in certain providers? Just take a look at their claims pattern and then identify where there might be opportunities. We then use that same claims review to identify out-of-network claims and proactively work to ensure that those claims are fair, reasonable, and do that before those are balance billed. Frequently, those claims are balance billed to the consumer, as we talked about earlier. Our approach is to get those claims, look at them, identify opportunities to reduce those claims before they're balance billed. The third thing that our solution does is look for other sort of issues with those claims. Maybe they're very high billing rates, maybe there's errors, maybe there's duplicates, and our technology can identify those claims that are sort of out of whack, and then we can work with their employees to address those particular opportunities. Perhaps they were double billed, or perhaps the rate's just very high, and then we can, proactively reach out to their employees and say, hey, we've got this claim for you. Our research tells us that it's probably incorrect. We'd like to help you resolve that. And then the last opportunity is that when we identify patterns of perhaps one provider that represents a significant out-of-network activity for you, we can work with that provider to negotiate prospectively a lower rate for you. So that, those are the four key things we can do. There's a lot more to it, but that's the four sort of key points of what our solution does.
That's great. Ron, do you have a question for
Yeah,
Tom?
Tom, I think what you're doing is growing in need and is desperately needed in the marketplace. And the main reason I see it, and I'd like you maybe to comment on it, as we see consolidation in the marketplace, hospitals are becoming more dominant. They're buying up other hospitals. They're buying up physician practices. And you mentioned anesthesiologists as an example where there could be an out-of-network provider. I think most people think if their primary care physician is in network and they're going to a hospital that's in network, that therefore all the providers of care within that hospital are network providers. And these days, an anesthesiologist and radiologist typically are employees of the hospital. Therefore, they say, why should I give a discount? I'm going to charge as much as I can because you can't avoid me. You're going to have to go to this hospital. Therefore, I'm not a network provider. I'm not going to discount. So you wind up with these enormous bills. And in many ways, it's not fair to the consumer because it's a total surprise to them.
Yeah.
And it needs somebody like you to step in and an organization like Copay to really pull these people back and have reasonable charges. So is that a big part of the market, what you're really having to address?
Yeah, absolutely. And, we see a couple of big trends, Ron, to sort of respond and talk about the trends we see in the market. There's a couple of trends. One is the consolidation of both on the payment side and the provider side, right? The payers and providers are consolidating, which has interesting dynamics it creates interesting dynamics in the industry. So that's the first thing we're seeing. The second thing that we're seeing is that the adoption of narrow networks has just been broad, right, as a way to control expenses. And, and I'm a true believer in CDH and the sort of movement that's underway and the adoption of high deductible health plans, but it does have a short-term and probably, kind of a midterm impact on consumers by raising their deductibles. So those kind of three things come together to create a real burden on consumers, and addressing those is what we're focused on. And your specific example of those out-of-network transactions that take place, you may get an invoice, a medical bill that has some in-network and some out-of-network things on it, and even I, as the CEO of this business, wouldn't be able to understand that. Right. And, you and the common person can't really do that. So that's what our technology enables, is to identify those opportunities and to work with folks to make sure that it's fair. So, exactly what our focus is.
Hey, Tom.
We're good.
Time flies when we're having fun here. We've got about a minute and a half to go, and I want to allow you to kind of, repackage this and leave our audience with some takeaways and how they can connect with you, how they can, contact you.
Yeah, sure. So first of all, I just want to again say thanks for having me on the show. It's been great being here, and I've always been a big fan of your organization, and I'm very excited on the opportunity to join you. So just a couple of key things. In 2015, the amount of the level of out-of-pocket incurred by consumers, out-of-pocket expenses, is closing in on $500 billion, driven by the trends that we're talking about. And our solution really gives individuals and employers a way to help them move through this process as this change is happening, and enable sort of taking some control over it. So that's really what our mission is all about. And we're excited to be focused on it, and we're excited to be associated with IHC in doing so. And we think it really makes sense for employers to offer this solution to their employees as this transition happens. And to reach me or to reach out to our organization, feel free to contact me at tom.torre, Torre, at copatient.com, or call me at 207-233-8974.
Tom, listen, I appreciate it. You're doing some good work up there. Keep it up, and we'll see you soon. Have a great weekend.
Thanks, you too. Thanks for having me on.